Hi, I'm Dr. Heidi Cook, and today we're at the spa at West Glen in West Glen Town Center in West Des Moines, Iowa. Often on the show, I have referred to different treatments and different procedures that we do here at the spa at West Glen, so I decided it would be great to invite you in and kind of show you some of the stuff in person. So with the spa at West Glen, we opened our doors in December of 2005, and at that time we were 3,500 square feet. In the end of December of 2012, we expanded into the 5,000 square feet spa that we are today. So the spa at West Glen is both a day spa and a medical spa. The day spa clients come in more to relax, de-stress, and they might have a nice massage or a relaxing facial. Then we have our medical spa clients who come in who are really focusing on treatments that are rejuvenating and kind of fighting those signs of aging. So no matter what client walks in the door, whether they're our day spa client, our medical spa client, what our hope is that they walk in the door and can leave the world behind, can escape the stresses of everyday life and come into a more tranquil and peaceful place. So those are our goals for our patients here at the spa at West Glen. We also invite people to come in early. They can rest in the relaxation area, have a glass of tea, coffee, or wine to kind of start their whole relaxing time here. So today I want to show you some of the different treatments, kind of demystify some of our medical treatments that we do here at the spa at West Glen. So have you ever woken up in the morning and thought, boy, I look more tired than I really feel? Or have you noticed those frown lines in between your brows and thought, I look grumpier than I really am? Both of those reasons are something to think about and something to consider Botox for. So Botox is a injectable that we and many spas offer at many different locations, but you really want to pick someone who's been doing Botox for a while and can tell you all about it. So that's what I want to do here today. Botox is what is considered a neuromodulator. What that is it affects the nerve and the muscles. So whenever you have a wrinkle that is caused by a muscle moving, that's the perfect place for Botox. So examples of that is those frown lines in between your brows, the horizontal forehead lines on your forehead, crow's feet. Those are all examples of a muscle causing a wrinkle. So what we do is if we know this muscle causes a wrinkle, we can go in and put Botox right into that muscle. What it does, Botox will find its way to what is called the neuromuscular junction. So in your body, you have a nerve that comes down to stimulate a muscle to contract. So what Botox is going to do, it's going to go into that area, it's going to attach to the nerve, and it's going to interrupt the neurotransmitter that causes the muscle to contract. So that's kind of how Botox works. Botox has been used in different medical treatments for many, many years, far longer than we have used it for cosmetic reasons. Examples are kids who have cerebral palsy and are tight. You can go in and relax their muscles with Botox. Also with people who have muscle spasms around their eyes, that's actually how Botox was noted to make a cosmetic difference, is they would treat these people with eye spasms and notice their wrinkles got better. People have had vocal cord spasms and Botox has been put into vocal cords. So there's a lot of different reasons that Botox has been used in medical settings prior to cosmetic. FDA approved Botox in 2002 for cosmetic reasons, and so we've been using it for the last 14 years to make people have a more rejuvenated, more youthful look. So the facial muscles are very unique. They attach directly to the skin, and that does not occur in any other place in the body. So that's a good thing in that we can make all of our facial expressions happy, sad, surprised, but it's also what causes those wrinkles that kind of irritate us. So when I am seeing a patient who's considering Botox, I like to tell them exactly what they can expect. Botox, because of its mechanism of action, takes a couple of days to really start working. So you're not going to wake up the next morning looking any different. Because of that chemical reaction needing to block that neurotransmitter, it is going to take 2 to 3 days to even start working. Maximum effect for Botox is typically around 10 to 14 days. I tell people if you have an event, a wedding, a reunion that you're doing this for, you want to do it at least 2 weeks ahead of time to make sure that you're kind of full go. After you have your Botox treatment, it will then last for about 3 to 4 months. If you do Botox on a regular basis, we often see that stretching out, and it's just because that muscle tends to get weaker each time that you do a Botox treatment. So the side effects that I like to tell patients about is anytime you stick a needle in the skin, bleeding, bruising, and infection are always possibilities. If someone is very worried about a possibility of a bruise, I tell them to avoid such products as aspirin, ibuprofen, Excedrin, some supplements such as fish oil, vitamin E for at least 1 week, maybe even 2 weeks prior to a treatment. Now this does not matter for me. You can take ibuprofen and I can inject you that afternoon, but it's just if you're worried about a bruise, those products thin your blood and will set you up a little bit more for that. Other side effects are kind of site specific. When you are injecting for the frown lines, it's a muscle that goes across the forehead, and it takes about 4 to 5 hours for that Botox to become settled in that neuromuscular junction. You're not going to move it anywhere major, but where I don't want it to go is downward. You can imagine if you got Botox put here and then went and laid in a massage pillow that's rubbing on that same area, it could come down into your eyelid and leave you with a droopy eye. So my typical instructions for patients after they have their Botox is to not have a facial, a massage, and no heavy working out that day. You can do all those things the next day. People after their Botox treatments can put on sunscreen and makeup right away. Many of them come in over their lunch hour and go right back to work. That night you can use whatever skin regimen you typically do. So with Botox, the areas that we can typically do, though there's typical areas, but there's also what I would consider some specialty areas. So the ones that are very common are the frown lines in between the brows. Can you frown for me? Look mad. So it's right in here. This muscle kind of goes across the eyebrows. So when we do Botox, I'm going to have you turn your head just a little bit. Okay. When it's frowning right in here, we march along that muscle and get that corrugator muscle is what that is. Can you wrinkle your nose? About the time we get this, we also get the bunny lines from the nasalis and the procerus muscle that we can get those. Can you raise your brows? This is the frontalis muscle that causes these horizontal lines. Now this is the muscle that you really have to be careful with. It's the one that creates all those lines, but it also lifts up your brow. So if we were to knock out that muscle from that eyebrows to the hairline and all the way across, you'd have a nice smooth forehead and really heavy brows. So that's one we have to be careful with. Crow's feet, you smile, is caused by a muscle going around the eye, so we can go in there and soften those. My favorite part, my personal favorite part of Botox is to put a little bit right under the tail of the eyebrow. What that does is it releases this pull down and you get just a little bit of a lateral brow lift out of it. And so if you put some right here, you can just get a tiny bit of a lateral brow lift. I notice that most when I go to put my makeup on that there's just more area there. So we are going to show you how this works. Botox is a watery substance, so it's actually very easy to inject, and the actual injections take less than 2 to 3 minutes. We start by cleaning off the different areas with the alcohol. And it is a needle. Many patients ask about that. It is a needle, but it is a very small needle. And I always tell the patients kind of where I'm going and what I'm doing so I don't frighten them. So typically I start over the nose. So this is the procerus muscle that creates this bunny line. And can you frown for me? This is the corrugator that causes those frown lines. So we march our way across here. Can you lift up your brow for me? Okay, and relax. This is the frontalis, that muscle that causes those horizontal lines. With her, I stay up in the kind of top 2/3 of her brow and in between her pupils. That way she can still lift out here and keep that brow elevated and not heavy. And then the last place with her I typically do is underneath the eyebrow for that lift. And then we soften up her lines around her eyes. We're going to do one more here. So that is half of her Botox treatment, and as you can see, it didn't take much time. Did that hurt?
Not at all.
So hopefully we kind of demystified Botox a bit for you, and if it's something that you're interested in, please look us up at the spa at West Glen. We would love to help you out. So today we're going to talk a little bit more about the different injectables that we offer here at the spa at West Glen. We offer two different categories. One is Botox, and that is the one when you have a wrinkle that is caused by a muscle moving, that's where we use Botox. The other kind of group of injectables that we use are called fillers. Now, to understand how and where we use fillers, you have to understand how the face ages. There's a couple of different things that happen in the aging face. First thing is your bones in your face and really all over your body are constantly going through a process of reabsorbing and laying down new bone. That's a very normal process. But as we age, the reabsorption becomes faster than the laying down of new bone. And what that leaves you with is thinner bones and thinner bones in your face. In addition to that, as you age, your collagen production in your skin greatly decreases, and also your elastin. Those give you the good tone of youthful skin. Then we have gravity. So you have thinning bones, not enough collagen and elastin, and then you have gravity taking its effect, and everything starts to fall forward. What that creates is some creases. Most commonly, we notice it in the nasolabial fold, which is the fold from your nose down to your lips. Also, you start getting this droopy mouth that can make you look unhappy when you're really not. We end up calling these marionette lines because they're very similar to what you would see on a marionette puppet with the lines coming down. Those are probably the most common areas that we have injected with different fillers. There are newer areas also, such as one of the big things that we do now, and it gives you a very natural look, is cheek augmentation. With cheek augmentation, because you have thinning bones and because we lose some of our subcutaneous fat, which leaves us sunken and flat, we can add in some filler, giving some volume back to this area. What I like about cheek augmentation is if you put the filler out laterally, you can get a natural lift, which helps this area without ever putting any filler there. So cheek augmentation is something that I really do like. In addition to cheek augmentation and doing your fillers in here and marionette lines, you can also plump lips. You can also go after those vertical lip lines that start as you age. Also, I've always impressed putting volume back into a chin. I don't think any of us look at ourselves and think, oh, I'm getting old in my chin, but I'm always impressed how that rejuvenates someone's look. So the different fillers, we have gone through kind of a whole realm of different fillers, starting with collagens that were derived from animal products. And what we use most now is hyaluronic acids. The ones that I use most commonly is Juvederm Ultra and Juvederm Ultra Plus. I use those for cheek augmentation and down in this area. And in that same family, Juvederm has come out with something called Voluma, and that one is FDA approved for cheek augmentation. There are others that are also hyaluronic acid, such as the different Restylane products, and those are nice products also. So those are the ones I most commonly use. Now, the fillers are a little bit different than Botox. Botox is a watery substance that is very quickly injected. And the fillers are more of a gel. And so the whole technique of putting them in is a little different. So we note the area that has decreased volume, or you can also go directly into some of these wrinkles and kind of lift them up with this gel-like product. So when we put it in, it is a little bit of a process of threading that in and even massaging on it to get it to meld a little bit to where you want it to be. So that is the whole process of the fillers. Side effects of fillers, just like Botox, whenever you stick a needle into the skin, regardless of what you're injecting, bleeding, bruising, and infection are possibilities. For people really worried about bruising, they should avoid aspirin, ibuprofen, Excedrin type products, and such supplements such as fish oils, vitamin E, ginkgo, all of those types of things. It's not an issue for me as the injector. I can inject someone who's taken any of those medications. It's just you might set yourself up for a little bit more of a bruise with thinner blood. So also, there are different areas that tend to bruise easier than others. And I would say for fillers, the place that tends to bruise the most is kind of down in the marionette line. You just have some more capillaries that you are dealing with in that area. So my instructions for people when they go home after their filler is most of the time they don't need to do anything as far as certain care on that filler area. Every once in a while, if there's some fullness of the product, I will have them massage on it a little bit. Now, you can typically tell a difference right away when you're doing fillers, but the final look is always a week to 2 weeks after. Hyaluronic acid, which is what Juvederm is, loves water. So once it's in there, it will pull in water and it will soften up the product and become even fuller and more natural looking. When they go home that night, they will be able to palpate and feel that gel in there. It's not something you can necessarily see, but they'll be able to feel it. In a week or 2 weeks, as it softens and pulls water in, you typically can't tell what is you and what's the product. So they are a great product for just naturally giving you more of a youthful, rejuvenated look. You can be overfilled, and so you'll probably want to take a look and pick your injector carefully because you don't want overfilled with these products. So just like with Botox, the patient will be cleaned off with alcohol. That decreases any bacteria on the surface. With the fillers, I personally don't feel like it's any more uncomfortable for fillers than Botox is. Some people feel that it is, so we do offer all of our filler patients, if they want to come in early for topical numbing cream, they can do that. It's very just personal to them. Some don't choose to do that at all. Some will choose to ice, which is what we're doing here. That just kind of chills the skin, makes that initial poke even less. Again, it is a needle, but it is a small needle. And the Juvederm comes in a pre-measured syringe. So basically the patients purchase their syringe and then we determine where we want to use it. In her today, we are going to focus on the nasolabial fold, which is the fold from the nose to the lip, and also a little bit in the corner of the mouth. So what we will do is I just place the needle and we slowly inject part of the gel. You can even see a little bit of raising right when you do it. And then I do a little massaging right on that little bit of the gel. After these treatments, they can go and put on some sunscreen and reapply makeup if they're going back to work. That night they can use whatever skincare they typically do. And now I'm going to go into this line that creates kind of the more little grumpy look. We'll go right into the corner. And you can lay kind of a little support there that helps turn that lower, or turn the sides of that lip back up. Now, the one area that I do highly recommend using the numbing cream for is the closer you get to the lip. So for lip augmentation, that can be quite tender. So for any place that you have lost volume, cheeks, nasolabial folds, corners of the mouth, if you want your lips plumped, the fillers are a great product to use there. The one that I like the best and use the most of is Juvederm, but to help you get a youthful look, consider using fillers.